This podcast is brought to you by Progressive Insurance. Do you ever find yourself playing the budgeting game? Shifting a little money here, a little there, hoping it all works out? Well, with the Name Your Price tool from Progressive, you can be a better budgeter and potentially lower your insurance bill too. You tell Progressive what you want to pay for car insurance. They'll help you find options within your budget. Try it today at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Not available in all states.
Nordstrom brings you the season's most wanted brands. Skims, Mango, Free People, and Princess Polly. All under $100. From trending sneakers to beauty must-haves, we've curated the styles you'll wear on repeat this spring. Free shipping, free returns, and in-store pickup make it easier than ever. Shop now in stores and at Nordstrom.com.
Can we go back in time 5 months ago when we were still learning who was going to be in President Trump's cabinet?
And now it is official from the president-elect himself. Donald Trump has named RFK Jr. as his pick for Health and Human Services Secretary.
Robert F. Kennedy was picked to lead the Department of Health and Human Services just a few days after Trump got reelected. His selection left a whole lot of people particularly flabbergasted.
What could he potentially do if he is confirmed by the Senate?
I think it would be a very destructive influence that he would have. He's not there to actually improve health. I think he's there to destroy it.
But you have to be able to believe in the scientific process that might disprove some of your views, and you have to accept those changes. And RFK Jr. has shown that he is unable to accept when his opinions, his views are debunked. And that's extremely dangerous and should be disqualifying.
This is a person who should not be anywhere near a health system of any kind. Certainly not in charge of the federal agency responsible for drug development and vaccines and the health of hundreds of millions of Americans.
The check on someone like RFK Jr. is supposed to be Congress. In January, he spent a couple of days being grilled on the Hill. It went about as well as you might expect.
Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
Democrats tried to expose Kennedy's fringe beliefs, the way he'd compared the work of the Centers for Disease Control to Nazi death camps, how he'd linked autism diagnoses to measles vaccination.
We've just had a measles case in Rhode Island, the first since 2013. And frankly, you frighten people.
How would you characterize Robert F. Kennedy's performance?
I would characterize it as not backed up by robust science.
Mother Jones' Kiera Butler was watching these hearings. She noticed as RFK confused Medicare and Medicaid more than once. She noticed when he stumbled over the basics of disease prevalence and clinical guidelines. He also seemed wholly unfamiliar with healthcare infrastructure. But in the end, none of it mattered.
Well, I think that maybe his sounding uninformed is an artifact of his lack of expertise on actual scientific literature. You know, this is a man who has spent the last decade plus of his career at the head of an anti-vaccine advocacy group, Children's Health Defense, that really doesn't rely on the kind of rigorous academic research that the folks were questioning him about during his confirmation hearing.
The headline of the article you wrote about the hearings was RFK Jr. is trying to hide who he really is. Why did you come away thinking that?
He is claiming that he was never anti-vaccine. There is abundant evidence to the contrary. This is an activist. He's not a scientist, and he's not a politician. He's an activist.
Now that RFK Jr. has been on the job helming the Department of Health and Human Services for a couple of months, do you feel like he is still hiding who he really is?
Well, I'm not sure that I would say, he is just letting his freak flag fly yet. However, just in recent weeks, he has promised to find the underlying cause of the autism epidemic.
Yeah. So it sounds like The real RFK Jr. is beginning to stand up.
Yes, I would say, particularly in these last few weeks, this is more of what we would have expected from him.
Today on the show, Robert F. Kennedy Jr. has begun to take command of public health in the U.S. So how is he making America healthy again? I'm Mary Harris. You're listening to What Next? Stick around.
This podcast is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Because Progressive offers discounts for paying in full, owning a home, and more. Plus, you can count on their great customer service to help you when you need it, so your dollar goes a long way. Visit Progressive.com to see if you could save on car insurance. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states and situations.
This episode is brought to you by Discover. It's smart to always have a few financial goals. And here's a really smart one you can set. Earning cash back on what you buy every day. With Discover, you can. Get this. Discover automatically matches all the cash back you've earned at the end of your first year. Seriously, all of it. Discover trusts you to make smart decisions. After all, you listen to this podcast. See terms at discover.com/creditcard. We should probably step back and just explain for those who don't know just how large the Department of Health and Human Services is, because a whole lot of agencies fall under the HHS umbrella. Can you just explain who is working under RFK at this point?
Yeah, absolutely. HHS as an agency is absolutely massive. Before the recent restructuring, it had about 82,000 full-time employees. And I think it's really important to note, under HHS are a number of agencies, including CDC, FDA, National Institutes of Health, Centers for Medicare and Medicaid Services, and many, many others.
And like a lot of agencies, the Department of Health and Human Services has been implementing job cuts. Where are those coming from? Like, are they coming from the headquarters or are they coming from individual agencies? Like, who is feeling the brunt of the cuts?
I think they're being broadly experienced throughout all of the individual agencies. I think the downsizing has been about a 25% reduction in the workforce, and that's just so far. You know, we don't know what's to come in the next few months. And this is a result, of course, of orders given by DOGE, headed by Elon Musk. And it really is affecting all of the agencies. You know, CDC, I think, has been particularly hard hit. The other thing that I would note is that former CDC employees are beginning to come together to basically try to recreate the work that they've been doing that has been dismantled at the CDC. So, you know, you see that there are initiatives with some of these former CDC employees to continue, you know, gathering this data, to disseminate reliable information about vaccines, about chronic disease, about what have you.
Are these rogue actors?
I don't think that you could really call them that, because they either quit under protest or they were laid off from CDC, and they have, you know, now that they're not affiliated with that agency anymore, they are trying very hard to continue doing the work that they were dedicated to doing as public servants. The folks at CDC who I've talked to who were spared in the recent layoffs have said that they are looking for new employment because this atmosphere of uncertainty is just such a drain on morale and on their ability to do their work that it's not sustainable for them.
Do any of them talk about what it would take to get them back? Like if someone just said, oops, you know, we shouldn't have cut that, come back.
You know, the government is just a colossal cruise ship, and to turn it around is a lot easier said than done. So I don't think it's like, you know, oops, we can bring all these folks back. You know, it would be an incredibly complicated feat of bureaucracy.
My understanding is that about a quarter of the funds that survive cuts are supposed to be directed towards the Administration for a Healthy America, which does sound a lot like MAHA, the Make America Healthy Again slogan that RFK is known for. So what would the Administration for a Healthy America be? What would it do?
I think that's what a lot of people are asking. In recent weeks, RFK Jr. has emphasized his desire to, quote unquote, get to the bottom of what he considers to be an epidemic of autism. He also has called for the link between vaccines and autism to be reinvestigated. This is a topic on which there is abundant scientific research showing that there is no link between vaccines and autism. Yet RFK Jr. has said that he will marshal resources, which are now scarcer than ever, in order to reopen this closed case.
Let's focus in on the autism, because RFK did give his first press conference recently, and he really did focus on autism. I think it's worth digging in there because it's just connected to so much else. What did he say at the press conference that stood out to you?
One sort of overarching thing that he did that really raised the hackles of a lot of people in the autism community and sort of in the medical community more broadly was that he framed autism as a debilitating disease and an epidemic.
This epidemic denial has become a feature in the mainstream media, and it's based on an industry canard. And obviously, there are people who don't want us to look at environmental exposures. And
the definition of autism is quite broad. You can be talking about nonverbal individuals who really need constant care for the rest of their lives. You can be talking about quite highly functional individuals who have a lot of focus that is useful to them in their work. And I think that's part of what is confusing here.
That's exactly right. When you talk about autism, the phrase that is used by psychologists and by doctors is autism spectrum disorder. It's a spectrum that ranges from people who need very little support to those who really need a lot of support. And in this press conference, RFK Jr. did not make that distinction.
These are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted.
He talked about stereotypical behaviors. One thing that he said in this conference is that there are no older autistic adults. And he said head banging, nonverbal, non-toilet trained, stimming, toe walking, these other stereotypical features. Where are these people walking around the mall?
Huh. That seems like a very specific kind of autistic person.
It does. Those behaviors are associated with very high support needs individuals. And also, the notion that he would see those people, as he said, walking around the mall, those are the kinds of people who society has shut away, frankly. They're not going to be walking around the mall because, these are folks who, because of stigma, often don't go out and are quite isolated.
It seems like he's also really interested in making the case that autism rates are rising dramatically. Is that true?
It is true, but it's sort of the question of what is behind those rising rates. And, the folks, the epidemiologists that my colleague Anna Merlan and I talked to all said that this spike in autism rates is an artifact of better diagnostic criteria. Over the last 10 years or so, there have been great strides in diagnosing autism earlier, and also in particular in girls. And so, the reason behind this rise in autism really has to do with the fact that more kids are being diagnosed at earlier ages so that they can receive appropriate support.
After the break, RFK Jr. confronts the first major health crisis of his tenure.
This episode is brought to you by Peloton. Everyone has a reason to change. Growing old, heartbreak, a fresh start. Whatever it may be, Peloton is here to get you through life's biggest moments. With instructors that speak your language and workouts that move to your own rhythm. Peloton's Tread and All Access membership help you set your targets, track your progress, and get stronger, making your fitness goals a reality. Find your push. Find your power. Peloton. Visit onepeloton.com.
Don't miss your chance to spring into deals at Lowe's. Right now, get 5 select 1-pint annuals for just $5. Plus, get a free 60-volt Toro battery when you purchase a select 60-volt Toro electric mower. With deals like these, your yard wins. Shop in-store or online today. Lowe's, we help, you save. Valid through 4/30 while supplies last. Actual plant size and selection varies by location. Excludes Hawaii.
The spirit of innovation is deeply ingrained in America, and Google is helping Americans innovate in ways both big and small. Central Texas Regional Mobility Authority is using Google AI to create smarter tolling systems and improve traffic flow for Texans. This is a new era of American innovation. Find out more at g.co/American Innovation.
At the same time that RFK Jr. is pushing ahead with that autism study, his department is also dealing with something else, a measles outbreak that is radiating from West Texas into the rest of the country. RFK has pushed the conspiracy theory that the measles vaccine might cause autism, of course. So in a way, these stories are linked. I asked Kiera for an update on how the federal health response is going.
There are now nearly 900 measles cases, and that's actually a figure from a few days ago, so it might be 900 or more by now. At the heart of this outbreak, where it spread rapidly, was a Mennonite community in West Texas. And in this community, there were a number of folks, though not all of them, who, for religious reasons, chose not to vaccinate their kids.
And this is often how outbreaks like this begin, in small, sheltered communities that maybe have less access to care or less interest in modern healthcare. And in the past, the response has been surround these communities with the protection they need, vaccination campaigns, things like that, so that the wider community is protected. What does the effort look like this time from RFK and his new colleagues?
Well, I reported on this clinic in Lubbock, Texas, that is a kind of a naturopathic, kind of religiously oriented clinic that had been handing out unproven measles remedies to families who had kids with measles. These remedies were things like cod liver oil, which contains vitamin A. They were handing out vitamin C and inhaled steroids, budesonide, which is similar to what you might find in like an asthma inhaler or in like Flonase.
Does any of that work?
There is not any research that suggests that regimen of those supplements and drugs is effective for measles. I will say that cod liver oil contains some vitamin A, and vitamin A is, in very high doses, in certain situations, part of like a tested protocol for measles. But the amount in cod liver oil and the doses that this clinic is giving it in, there's no evidence that can be helpful. So this was a clinic that was, giving out these unproven remedies, and I reported on how Children's Health Defense, that's RFK Jr.'s anti-vaccine group that he used to run, teamed up with this clinic to create this online like GoFundMe kind of thing, like a fundraiser, to raise money for this clinic to distribute these unproven remedies. And I also found out through a call with one of the folks involved in that effort that there had been a phone call between RFK Jr. and the head doctor at this clinic and a local member of the Mennonite community, Mennonite historian. And so, this, on the one hand, it's like, it's not unexpected that the Department of Health and Human Services would want to be in touch with people on the ground who are affected by an outbreak. On the other hand, it's quite unusual that the HHS secretary would talk to a kind of a naturopathic clinic that's distributing these unproven remedies.
Some of the parents whose children, 2 children have died in this outbreak, whose children died, my understanding is there was a video that was made with them.
There have been a few videos now, but the one that I wrote about, it was an interview with the parents of the 6-year-old girl who died of measles, and there was a translator there. This is a couple that spoke low German. The dad didn't have much English. The mom had a little more. But in the video, they sort of reiterated their belief that vaccines are harmful.
And this was released by Children's Health Defense?
This was the video that was produced by Children's Health Defense. That's right. Yeah.
With this video, you seem to be really affected by it. You wrote about how you usually try to separate your emotion from your reporting, but you kind of couldn't with this video. Why was that?
It was truly, truly heartbreaking. And it was so frustrating. What the parents said was that after their daughter died of measles, the other kids got measles and were given these untested remedies by this holistic clinic. And they said, well, those remedies must have saved our children's lives because they ended up being fine, whereas our daughter who didn't get these remedies ended up dying.
But measles is, I think it's deadly in like 1 in 1,000 people or something like that.
That's exactly right. So no matter, whether they had received these remedies or not, you wouldn't expect those kids to die. Toward the end of the video, they were saying that, I'm going to paraphrase, I can't remember exactly how they phrased it, but they were saying, that their child's death had been God's will and that, she was in a better place now. And just, this preventable tragedy that they were being forced to kind of justify it like that just really, it really affected me. Yeah.
From the outside, I look at what's happening at the Department of Health and Human Services and with Robert F. Kennedy, and it seems like this straightforward compromise where the Trump administration gets a lot of cuts because that's what they want to do, and Robert F. Kennedy gets to kind of do what he wants to do, which is, go full Maha and really look into autism specifically. And it sounds like he can keep doing that as long as he, keeps firing people, I guess, or putting them on leave. Is that how it reads to you too?
Not to totally relitigate the election or Trump's campaign, but I think it is entirely logical to see the relationship between Trump and RFK Jr. as mutually beneficial. There was, I don't have the exact figures at my fingertips, but just a few weeks after the election, it became clear that a number of people who ended up voting for Trump had been supporting RFK Jr. in his presidential run. And I think that the Trump team, the MAGA team, realized this. And even though RFK Jr. comes from this long line of Democrats and had initially been running as a Democrat, they realized that these voters who were supporting Kennedy could move the needle for them.
Is this what RFK Jr.'s constituency wanted, though? I don't imagine them wanting cuts to public health. They seem to be kind of interested in public health.
Yeah, it depends how you think about it, right? This is a group who they're deeply skeptical of the government. So, public health to them means mask mandates, means vaccine mandates. This is a group that was really energized during COVID to kind of oppose the project of public health as it's been understood and established. So, you've had a few RFK Jr., prominent RFK Jr. supporters grumbling over the last few months about RFK Jr.'s statements that MMR vaccine is an important tool, that kind of thing. But largely, I think his supporters have been happy with this project and that they've been, encouraged by these cuts to CDC and other public health agencies because they believe in this idea of what they call medical freedom. They believe in the idea that the government should have a limited role in the health of Americans.
Kiera, I'm grateful for your time. Thanks for coming on the show.
Thank you so much for having me.
Kiera Butler is a senior editor and reporter at Mother Jones. And that's the show. What Next is produced by Paige Osburn, Elena Schwartz, Rob Gunther, Anna Phillips, Ethan Oberman, Isabel Angell, and Madeline Ducharme. Ben Richmond is the senior director of podcast operations here at Slate. And I'm Mary Harris. Go track me down on Blue Sky. I'm at Mary Harris. Thanks for listening. Catch you back here next time.